Hi, I'm Dr. Amber Nixon with Healing Peak Regenerative Medicine's Longevity Channel, and today I want to talk to you about rehabbing an injury or a joint that's been strained or sprained after surgery, that sort of thing. How do you get started? I get this question a lot with my patients. How do I, now that there's no more pain in my joint, now that I'm healed, how do I start using it again and feel confident in it again? Often this happens, or the question comes, after a lot of PRP or prolotherapy injections, their pain is gone, it's functioning normally, but they're kind of afraid to really use it again the way that they could before because it doesn't feel quite strong enough yet. And so I often get the question, where do I start? How do I do this? Physical therapy is always a great place to start, but it's not always available to everyone. So if physical therapy is not an option for you, but you still need to rehab your joint, how do you start that process? And what I tell people is to set some reachable goals. Set some goals that probably seem pretty easy for you to master, but repetitively, maybe that becomes difficult. And then secondarily, what is the ultimate goal? Do you want to climb a mountain? Do you want to get down on the floor with your grandkids? Do you want to be able to do a pull-up? What are you really hoping to, have out of that joint once it fully feels strong enough to do something that you really want to do? And then, secondarily, start those reachable goals, see how that feels. If it starts to bother you, stop doing it. If it's bothering you during an exercise, then stop doing it. Allow it to get back to the main place where it doesn't have pain anymore, and then try those exercises again. And eventually you'll be able to do more and more and more reps. And it may feel like a long and tedious process, but reps are the key to getting better. And so, once you've met those repetitions and those goals of those small exercises that, your day-to-day exercises that you can do, then it's time to move on to some bigger exercises. The main thing I see happen with re-injury is that people are pushing themselves too hard during a workout, thinking, oh, there's no pain, I'm doing so great. They feel that something during the workout that's bothering it, and they keep going. And so I would really encourage you in that moment to stop and either just stop the workout or, reposition yourself in a place where it does not hurt but is still good form, or start working out a different part of your body. Like if you're working out your shoulder joint and that's what you injured, then start doing something with your legs instead and allow that to rest. Recover. Wait until you're fully sure that it feels really nice again and really good again before you had started working out, and then attempt some rehab exercises again. And it's going to be this like back and forth dance, until that joint starts to regain that strength that it had previously. And then the other thing that I really encourage people to do when rehabbing an injury is to eat really well. When you injure a joint, or if you're post-surgery, whether it's joint replacement or whether it's an injury, you sprained a ligament or tendon, or you are getting injected, your body had an acute situation happen to it, and then that depletes you of essential vitamins and nutrients needed for healing. And so you have to think that you use some reserves in order to deal with that injury and heal that up. So you want to continue to really, give yourself the nutrients and vitamins that your body needs. Really main nutrients for joint healing are vitamin C, zinc, and some form of collagen building powder, obviously from a sustainable source, really high quality. You want to make sure all your vitamins are high quality and that they're not going to conflict with any medications that you're on. And if I'm not your doctor, please consult your doctor before starting any supplements or nutrients. That's just my full disclaimer there. But those are the three things that are really important for joint health, ligament health, and rebuilding of muscles, tendon repair, and all of that. So feed your body what the joint needs. Lots of veggies, an anti-inflammatory diet. And your body will use those nutrients to really heal up that joint or that ligament. And then the other thing I really think is important is to visualize yourself doing the exercise you ultimately want to do. Doing a pull-up, or visualize yourself doing lunges, or visualize yourself able to totally get into a full squat position, without assistance. If you can really visualize yourself doing those types of exercises in your mind's eye, eventually you will get there. The mind is so powerful. And I mean, we've heard this time and again with Olympic athletes or professional athletes. They're all visualizing themselves making that touchdown, nailing that jump or whatever it is that they are doing, right? They're visualizing it. That's part of their coaching process. And so there's a reason for that. If you can visualize yourself doing it, you will get there. It may take time, but it'll happen. And those are really the primary things that I really encourage my patients to do, is have patience with themselves. Make sure they do the reps. Always do the reps. Sometimes you have to go backwards before you can go forwards, and just really listening to your body. If it's bothering you while you're working out, it's time to stop. That's the number one thing. You will get to do that exercise again, but if you re-injure yourself, then we're kind of back to square one. If you want any more information on how to rehab a joint or injury, please follow me at Dr. Amber Nixon. It's healingpeak.com is my website, or my handle for Instagram is at Dr. Amber Nixon. Or you can give us a call at 206-899-6000. Please like my video or subscribe if you enjoyed it. Thanks.